Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And I'm joined here by my colleagues, Jenice and Sara Fisher, and they're here to talk about using the pelvic floor, activating the pelvic floor in your clients, especially your female clients that have trouble with chronic low back tightness, pelvic pain, or even hip tightness or weakness. Many of your clients will come to you and say that I read on the internet that I should do Kegels after my baby or to strengthen my pelvic floor or when I exercise. And unless your client has been specifically examined and told by a pelvic floor therapist and or an OB-GYN, that's an internal exam, Kegels aren't appropriate for every single female client, especially after pregnancy and or surgery. So I'm going to have Jenice and Sara discuss why this is not always appropriate for your female clients and how to properly activate the pelvic floor in your female clients as part of their core stabilization strategy.
Great, thank you, Dr. Osar. I'm not pushing you out of the camera as I did last week, since you were offended by that, apparently. So, first up, Dr. Osar talked about how we want to make sure that your clients have seen a pelvic floor therapist or an OB-GYN that's actually done internal work to make sure that there is an actual problem and exactly what that problem is with the client's pelvic floor. So I'm actually going to read you just a brief section from Dr. Osar's book, The SOI Solution, which actually he is quoting the pelvic floor therapist that we refer our clients to, Judith Florendo. And in here she said, the key to gaining optimal control of the pelvic floor is through breathing. After I teach someone diaphragmatic breathing first, then I move on to the pelvic floor. With pelvic floor hypertension or pain problems, I cue them to inhale all the way down into the pelvis. And she also uses testing to make sure that that actually is having the effect that she wants. Oftentimes, we'll have clients come in after they've had a baby or seen their OB-GYN who doesn't necessarily test for pelvic floor muscle issues, and they've been told to do 200 Kegels a day.
Exactly, a day. And so women are squeezing, and trying to do 200 Kegels a day, and they're not sure if they're actually doing them well, doing them right, or if they're even still appropriate. So they come to us with questions, or in your case, they may be coming to you with these questions.
Yeah, and we are all familiar, if you're not, a Kegel is just where you pull the pelvic floor up and in, and sometimes you're told to hold it, or continuing to do that, and it'll strengthen your pelvic floor. And most people, if you ask them to do that, can do that quite well and quite easily. The challenge is most people never let that truly go. Because if you have a client who's struggling with any kind of urinary incontinence or things like that, they're always holding that pelvic floor in. Every time they try to cough or sneeze or they're running to the bathroom, they're always having that urgency, so they're always slightly holding that pelvic floor in. So what we found is a lot of clients really can't let that go, because just go ahead and see, so you have clients who like to squeeze their glutes, or they have pelvic floor issues. If they're always holding their pelvic floor in, but you tell them to relax their glutes, it's nearly impossible to do that. So they're always causing more and more issues. So I'm going to have Sara tell you exactly how we have our clients start this process using diaphragmatic breathing, or three-dimensional breathing as we call it, to start to change their pelvic floor.
That's right. So if you want to join me, you can experience this for yourself. You're going to start wherever you are, just sitting tall on the edge of your chair, or if you're standing up, make sure your weight is equal between both of your feet. And then you're just going to place your hands on your pelvis, so your hip bone's right in the front, letting your fingers just rest inside your abdomen there. And then all you're going to do is just gently picture relaxing your glutes. So if you're squeezing, picture letting them go. And then I want you just to take an inhale and imagine that inhale gently making its way down into your hands. So you're not going to force it and push it out into your fingers, you're just letting the breath make its way there. Then when you exhale, you just gently but completely exhale, so don't force it. And then you just inhale again, letting your breath make its way down into your hands. And then you gently exhale, letting that exhale go out completely, but gently. One more time, just gently inhale into your hands, letting those glutes continue to relax. And then gently exhale, but softly, but fully exhale. And you can start to get that sense that the breath is starting to make its way all the way down towards that pelvic floor. So you're already starting to train how to let the pelvic floor relax. So you're not letting go to the point where you're letting it drop out. That's not what's happening here. You're actually just getting that descent and then that rise on the exhale. On the inhale, it lowers, and on the exhale, it starts to rise again. So you get that nice, gentle motion up and down.
Because if you think about it, if you were to do a Kegels right now and squeeze and hold in and hold that and try to take a breath, you're not really going to be able to get your breath low because now you're actually contracting a muscle. You're using a concentric contraction, not to get too complicated, to actually, when you actually need to be having an eccentric contraction of that pelvic floor when you inhale. So it's very counterintuitive to constantly be holding that pelvic floor in and trying to breathe at the same time when they should be moving together. And that's what Sara was showing you with her hands. And one thing that we want to share with you that Sara and I spend a lot of time with women, especially post-surgery, is they can't get that breath into that lower pelvic area. Sometimes you'll see a woman who's had a C-section or a hysterectomy and they'll breathe right to the top of that scar and they can't get that breath lower. So seeing them with the big belly isn't the kind of breath that we're looking for. We're really looking for that breath that goes down into the pelvis where you don't see this big expansion of the actual abdomen itself. So that's one thing you want to think about when you're working with your clients, trying to get that low breath. And using your hands or having them put their hands on their pelvis and getting a sense of just pressure, a gentle pressure in that pelvis is going to help them understand that. Or having them put their hands even down into their sits bones and feeling that gentle breath, sometimes coming off of the sits bones before they actually feel it coming into the sits bones.
Yeah. And a lot of times clients will say, oh, my hips feel so much more relaxed, or it feels softer. That's a very common response that we get when people are able to start to let go of the glutes and start to relax and be able to get that breath fully down into the base of the pelvis.
And while this one is not a regular thing that happens, or whatever people say when that magical hat thing, the results aren't common. We have had people, when we've done this with our group classes at conventions, a woman actually came up to us and said, I've always had hip pain. And after doing this, it's the first time I've not had hip pain in years. That's miraculous. That was just taking her through 5 minutes of a breathing exercise. It's very cool. Results are not common, but you can actually have your clients say, oh my gosh, my hips, my glutes, everything just feels easier, lighter, softer. Their legs feel lighter. When you can get them to truly let that pelvic floor gripping relax and start to be in continuity with the diaphragm and the breath, it's actually really cool.
It's really amazing.
Yeah. We get a little excited about stuff like that. Yeah. So with that, Sara and I are going to do this and a whole lot more at our seminar next month in October 11th and 12th.
Yes, 11th and 12th.
11th and 12th. That's a Friday and a Saturday here in Chicago in our office. Space is very limited to 10 to 12 people. So we have early bird special ending this week, I believe. So if you'd like to join us, please make sure that you sign up. Everyone who signs up for the Friday, Saturday class gets a copy of our book, What Lies Beneath the Under-Realized Effects of Breast, Abdominal, and Pelvic Surgery. And then everyone who completes both courses will get 30 days free access to the Female Core Training 2.0 that we created with Dr. Osar. You'll have 30 days free access to that, which is awesome because it covers that and so much more of what we talk about in the class. So day one is going to be working with your clients post-surgery. Post-surgery meaning 2 days to 60 years post-surgery. What you need to do to help your clients in that post-surgery cycle start to regain core function, ideal and optimal core function. And then what are we talking about on day two, Sara?
Day two, we are reframing core training. So we're changing how we look at core, conventional core training. And do we really need to plank for 8 minutes? Do we really need to do crunches and sit-ups? And how do we change our client strategies for improving their core function, but also aesthetics, because that's a big one for clients, especially post-baby and post-surgery. They're very self-conscious about their abdominal appearance.
And one of the things that this course was also going to entail is how do we actually assess the effects of core exercise on our clients? Is it really getting beyond the aesthetics? Are we actually promoting, as a fitness professional, are we actually promoting good spine and joint health when we're giving our core exercises to our clients? And we're going to give you great strategies for you and your client to determine if the exercises are helping or hindering the progress they're really looking for when it comes to spine and joint health, and returning and getting to those goals that they're really working towards in their sessions with you. So we invite you to join us. Get your free copy of our book, get your free access to the Female Core 2.0 after the course is over, and we'll see you in Chicago next month. Take care, have a great day.
Bye-bye.